I'm Sean Parker. I'm a corneal and refractive specialist at Eye Care Specialist. Well, growing up, I always wanted to be a doctor. I knew that from the very start. When I found out I wasn't going to be a football player professionally, I thought, well, I'll turn to a profession to help other people. So that's something that I've always wanted to do. At the time, when I went to medical school, I knew I wanted to be a doctor, but wasn't really sure exactly what field I wanted to do. I grew up with my best friend, and his father was an allergist, so that's kind of what I thought I was going to do. And in medical school, you get exposed to a lot of different avenues of medicine, and I just found that ophthalmology, and especially eye surgery, was really appealing. And so did some research in the summertime and found that that's what I really loved to do, was to do microsurgery. But with ophthalmology, the nice thing is you get not only continuity of care with patients, but you also have the surgical side of it, which has been really appealing to me. After my corneal fellowship in Indianapolis, I moved to Cape Girardeau, Missouri, where I've been here for about 17 years now. I grew up in Kentucky and went to high school in Murray High, Kentucky, and went to Murray State as an undergraduate, and then went on to the University of Louisville, where I did medical school, and afterwards stayed there and did my residency in ophthalmology at the University of Louisville, Kentucky Lions Eye Institute. And after completing residency, I did an additional year of fellowship training in Indianapolis, and then kind of wanted to come back to the area that I grew up in, so Cape Girardeau was a wonderful area to go to, and that's where I've been ever since. Well, at the time that I finished my ophthalmology residency, LASIK surgery just was starting to become on the forefront. And I found it so powerful to be able to perform a surgery to fix people who have had the cumbersome burden of having to wear glasses and contact lenses for most of their life, and all of a sudden, one day, be able to wake up and see. I thought it was spectacular. So this was very early on in the course of LASIK, so I decided to pursue a fellowship in refractive surgery. And many of the refractive surgery fellowships at that time combined corneal surgery, as most refractive surgery is done on the cornea. So that I wanted that extra experience to really be able to do the best job that I can. One of the things that I really enjoy is my typical work week will start out first with taking the kids to school, which I've loved to do. It really starts the day out nice. And then I usually start the workday on a clinic day around 8 o'clock, and then I have a full schedule of patients, and I see a variety of patients. I see cataract patients, refractive patients, corneal patients, and glaucoma patients, so it's a nice variety. I'll do pre-op exams and just general exams, and then the nice thing with my week is it's not all one thing. So then I'll have a surgery day, and typically I'll have a cataract surgery day, and we'll do cataract surgery with lens implantation, and the modern lens implants are extremely wonderful these days to be able to actually return people back to seeing again, which is an incredible experience. Then I'll have typically a Friday I'll do LASIK surgery, and on a Wednesday I'll do surgery at the hospital, where I'll do more complicated surgeries like corneal transplants and some other lens implant type of surgeries, as well as pterygium and some glaucoma surgery. So I have a very varied schedule, and it keeps things fresh, keeps me very busy of trying to keep up with all the technology, but I find that it just makes my whole work week just much more pleasurable and fun and exciting. When I'm not at work, one of the things that I like to do to relax is spend time with my family. I have 3 beautiful children, and we have a small little lake house on Kentucky Lake that we like to escape to on the weekends when we can, and that's where we spend a lot of time together as a family and have a lot of fun. We enjoy being on the water with skiing and fishing, and that's one of the really fun things that we like to do. As far as hobbies, what I like to do is I like to play tennis and golf. I never get to do that as much as I'd like to, maybe one of these days. If I wasn't an ophthalmologist, I probably would be in the restaurant business. I grew up, my father owned restaurants and pizza stores, and I worked in a pizza store for most of my childhood, making pizzas, delivering pizzas, and so I did kind of find and develop a love for the food business. So if I wasn't an ophthalmologist, I would probably have a restaurant somewhere serving people. What do I love about Eye Care Specialist? What makes it so unique for me to come to work is we have such dedicated staff and dedicated physicians. We cover the whole gambit of specialty of the eye. If I have a problem with the back of the eye, which is not my specialty, we have 2 retina specialists here in the office that I'm able to send the patient to specialize on retina problems. We have a pediatric ophthalmologist that does nothing but kids, so we have that specialty as well. We have 6 locations throughout the tri-state area to take care of the needs of this area. One of the unique also experiences is that our staff has been here for as long as I have. It's really an incredible experience to have patients come in and see the same staff member, and it makes them feel comfortable that they've been coming for years, and the staff in the front to the technicians to the back have all been here, so it's a big family, and it makes it just extremely enjoyable, and I think that's very unique in the workplace right now. So when I come to work, it's like my second family, and it's a special place.